You're over 60 and experiencing burning feet, numb toes, electric shock sensations, tingling, or problems with balance. These are not simply strange or unavoidable signs of growing older. They stem from a biological environment inside your body that has gradually shifted over many years. Most people are told that peripheral neuropathy means the nerves simply wear out with age, like an old machine slowly breaking down. Others hear it's genetic and there's little that can be done. The common message, sometimes direct, sometimes implied, is that the best option is to control the pain while expecting the condition to steadily worsen. What is rarely made clear is that nerves do not deteriorate randomly or without reason. They respond directly to the chemical conditions, blood supply, and daily metabolic signals they receive. When that internal environment becomes harmful, nerves struggle and begin to fail. When it improves, many nerves can hold on to more function than most people expect. Peripheral neuropathy is not one single disease. It is a pattern of nerve damage. It describes what happens when the peripheral nerves, the long pathways that connect the brain and spinal cord to the rest of the body, start to malfunction. These nerves carry signals for sensation, movement, balance, temperature, and pain. Because they are very long and highly energy demanding, they are especially vulnerable to issues like unstable blood sugar, poor circulation, chronic inflammation, and nutrient shortages. This is why symptoms typically appear first in the feet and hands, the points farthest from the heart and most reliant on tiny blood vessels. An important truth is that nerve damage develops silently for a long time before any symptoms become noticeable. For years and sometimes decades, nerves quietly endure ongoing metabolic stress without clear warning signs. During this hidden phase, damage progresses. Proteins in the nerve fibers become distorted, blood vessels stiffen, the protective coating thins, and electrical signals slow or become less accurate. The nervous system compensates for a while, masking these early changes. By the time burning pain, numbness, or unsteadiness appears, the damage is already considerable. This long delay is why neuropathy often feels sudden and deeply unfair, even though it built up slowly over time. In many cases, a major culprit is a group of compounds known as advanced glycation end products, or AGEs. These form when glucose permanently attaches to proteins and fats throughout the body. This attachment is not harmless. It changes the structure and function of those tissues. Once created, AGEs are very difficult to remove and continue to build up over the years. They particularly harm tissues that require flexibility, precise signaling, and healthy microcirculation, which makes peripheral nerves one of their main targets. To see why AGEs are so damaging, consider what happens at the molecular level. Glucose is essential for energy, but it is also chemically reactive. When blood sugar remains elevated for extended periods, glucose interacts more frequently with proteins. Over time, under certain conditions, this leads to permanent, rigid, sticky crosslinks between molecules. It is similar to the way sugar hardens and caramelizes when heated. In the body, the process occurs slowly and steadily when glucose control is poor. The result is tissue that loses elasticity, functions less effectively, and becomes more prone to inflammation. In peripheral nerves, AGEs cause damage in three main ways at the same time. First, they alter the nerve fibers themselves, interfering with the proteins needed to transmit electrical impulses properly. Second, they damage the myelin sheath, the insulating fatty layer that enables fast and reliable signal transmission. When myelin is harmed, signals slow down, weaken, or become distorted. Third, AGEs injure the small blood vessels that deliver oxygen and nutrients to the nerves. These tiny capillaries are vital for nerve survival. When they stiffen or narrow, the nerves become undernourished and progressively weaker. This combined triple attack explains the wide range of symptoms: burning pain from irritated and overactive nerve fibers, numbness from missing or lost signals, tingling or pins and needles from irregular firing, weakness from disrupted muscle commands, and balance difficulties from unreliable sensory input to the brain. The specific combination and intensity of symptoms vary between individuals, but the underlying mechanism is often very similar. A detail frequently overlooked is that fasting blood sugar tests provide only a limited picture. Many people with neuropathy are told their glucose is normal because their fasting levels fall within standard ranges. However, fasting only shows the daily low point. It misses the damaging high points. The greatest risk for age formation occurs after meals, when blood sugar rises sharply and often stays elevated for hours. These repeated post-meal spikes are a primary driver of long-term nerve damage. As we age, the body becomes less efficient at clearing glucose from the bloodstream. Muscle mass naturally declines, insulin sensitivity decreases, and sugar lingers longer after eating. This does not mean aging itself directly causes neuropathy. It means aging reduces the body's metabolic resilience. When combined with common modern habits, such as frequent snacking, eating late at night, and consuming processed foods, it creates ideal conditions for ages to accumulate. Vitamin B12 plays another essential role. It helps maintain the myelin sheath, supports DNA synthesis in nerve cells, and assists in clearing harmful byproducts. B12 absorption often declines with age and is further reduced by common medications such as acid blockers and metformin. Low B12 removes a key protective factor for nerves, allowing damage to advance instead of being repaired. Standard blood tests can sometimes miss functional B12 deficiency. The measured levels may appear normal, yet still be insufficient for what nerves actually need. This discrepancy leaves many people vulnerable for years without realizing it. By the time clear symptoms emerge, the deficiency may have been present for a long time. Dietary ages are another often ignored contributor. Ages form inside the body, but they are also absorbed directly from food. High-heat cooking methods, grilling, frying, roasting, and browning, generate large amounts of preformed ages. These are taken into the body and add to the overall load. Even with good blood sugar control, certain cooking habits can significantly accelerate tissue damage. Switching to gentler, lower-heat cooking methods can greatly reduce this extra burden. Once damage starts, inflammation makes everything worse. Ages trigger immune responses that keep nerves irritated and inflamed. This is why symptoms frequently intensify at night when circulation naturally slows and inflammation lingers. It also explains how neuropathy disrupts sleep, setting up a vicious cycle. Poor sleep increases insulin resistance, stress hormones, and sugar spikes, which produce more ages and inflammation, further harming sleep. Physical movement is one of the most powerful ways to interrupt this cycle. Muscles naturally pull glucose out of the blood after meals. Even short, gentle walks can substantially lower post-meal sugar levels. This benefit is not primarily about weight loss or intense workouts. It is about improved metabolic regulation. Consistent activity reduces the raw material available for age formation and enhances blood flow to nerves. Maintaining muscle strength also matters. Muscle loss impairs glucose uptake. Light resistance exercises help preserve muscle mass, support metabolism, and indirectly protect nerves. This advantage often goes unnoticed because it develops slowly, not overnight. Hydration supports healthy circulation and helps clear metabolic waste. Dehydration makes blood thicker, reduces flow through microvessels, and concentrates glucose. Many older adults drink less fluid over time without noticing, quietly increasing risk to their nerves. Regular, adequate water intake strengthens vessel health with very little effort. Stress affects neuropathy through hormonal pathways. Chronic stress raises cortisol, which elevates blood sugar and promotes insulin resistance. Stress by itself does not cause neuropathy, but it worsens the metabolic conditions that harm nerves. Simple stress reduction techniques can ease this load and improve overall stability. One of the most damaging misconceptions about peripheral neuropathy is that progression is inevitable and nothing can change it. This belief discourages people from taking action and leads to passive acceptance of decline. While severely damaged nerves may not fully recover, many partially affected nerves can stabilize and perform better when placed in a more supportive environment. People often report reduced pain, better balance, improved sleep, and a higher quality of life once new damage slows or stops. The realistic goal is not perfection, it is protection. Every period of stable blood sugar gives nerves a break from chemical stress. Each better night of sleep supports repair processes. Each reduction in inflammation improves signaling. Over months and years, these small positive changes accumulate, just as the earlier losses did. Peripheral neuropathy is not merely a nerve problem, it is a metabolic condition that shows up first and most noticeably in the nerves. Understanding it this way changes everything from an unavoidable fate to something you can meaningfully influence. The focus shifts from only managing symptoms to also stabilizing the underlying causes. This approach offers no false promises of miracles, but it provides something far more dependable, real influence over the process, and that influence makes a significant difference. When people understand that peripheral neuropathy results from prolonged metabolic stress rather than sudden nerve failure, another insight often emerges. The nervous system does not function in isolation. It interacts constantly with other body systems. Blood vessels, muscles, hormones, the immune system, and the gut all play roles in whether nerves remain resilient or gradually deteriorate. This interconnectedness explains why neuropathy is rarely seen alone. It usually appears alongside fatigue, sleep problems, digestive changes, balance issues, or mild brain fog. These are not separate problems, they are different signs of the same core imbalance. A commonly missed contributor is persistently elevated blood sugar after meals that does not yet meet the criteria for diabetes. Many people spend years in this in-between zone, where glucose surges high and lingers after eating, yet routine tests still read as normal. During this time, ages build up quietly. Without a formal diagnosis, people assume nothing serious is being overlooked. But neuropathy does not require a label to develop. Nerves respond to their chemical surroundings, not to diagnostic cutoffs. Glucose clearance relies heavily on muscle tissue. After meals, insulin signals muscles to take in and store sugar. When muscle mass declines, this mechanism weakens. Glucose stays in the blood longer, extending the time available for glycation. This connection helps explain why neuropathy risk rises with age, even in people who have not gained weight. Even lean, apparently healthy individuals may have lost considerable muscle, especially without regular strength training. This muscle-glucose link also shows why physical activity provides strong nerve protection, even without major changes to diet. Regular short walks after meals reduce both the height and duration of sugar spikes. Over months and years, this leads to fewer ages, lower inflammation, and better circulation. The benefit starts modestly but becomes substantial over time. It addresses the root cause more directly than approaches focused only on symptoms. The vascular system plays a central role as well. Nerves depend on a delicate network of small blood vessels that are highly sensitive to glycation and oxidative damage. Ages stiffen vessel walls, reduce nitric oxide production, and impair healthy dilation. This leads to chronic mild underoxygenation, especially in the longest nerves. The feet are affected first not because they are inherently weak, but because they are the farthest from the main blood supply. This vascular factor explains why symptoms often worsen in cold weather or at night, when blood flow naturally decreases. It also accounts for why a history of smoking increases risk. Vascular damage persists long-term and adds to metabolic injury. Inflammation runs through the entire process. Ages activate receptors that trigger ongoing inflammatory cascades. These increase oxidative stress, impair energy production in nerve cells, and worsen insulin resistance. Inflammation both results from damage and drives more damage. This self-reinforcing cycle explains why neuropathy can accelerate after symptoms first appear, even without major lifestyle shifts. Sleep is a vital repair period. During deep sleep, inflammation decreases, insulin sensitivity improves, and growth factors support nerve maintenance. When neuropathy disrupts sleep, it shortens this recovery window. Over time, poor sleep undermines metabolic control and speeds up nerve damage. This two-way relationship means that even small improvements in sleep can produce meaningful benefits. Eating late at night is especially damaging in this context. Food close to bedtime raises blood sugar at a time when insulin sensitivity is already lower. This prolongs hyperglycemia and interferes with overnight repair processes. Simply shifting the last meal earlier can improve sleep quickly and gradually ease neuropathy symptoms. No new foods or medications are needed, just better timing aligned with the body's natural rhythms. Gut health also influences nerve function. The gut handles nutrient absorption, regulates immunity, and controls inflammation. Poor digestion or chronic gut irritation can reduce absorption of B vitamins, magnesium, and other key nutrients. It can also promote systemic inflammation. Gut problems rarely cause neuropathy on their own, but they increase risk and slow recovery. Supporting gut function improves the overall environment for nerves. Emotional and psychological factors deserve attention too. Ongoing pain, worry about progression, and fear can lead to anxiety or depression. These states disrupt sleep, raise stress hormones, and reduce motivation for self-care. This creates another reinforcing cycle that is psychological but has strong physical effects. Breaking it requires self-compassion, support from others, and realistic expectations rather than self-blame. Not every case of neuropathy is metabolic. Autoimmune diseases, infections, toxins, chemotherapy, and genetic factors can also damage nerves. However, even in those situations, metabolic health strongly influences severity and progression. Stabilizing blood sugar, reducing inflammation, and supporting circulation benefit nerves no matter what the original cause may be. This makes metabolic strategies a foundational part of care in nearly all cases. When people begin making adjustments to improve their metabolic environment, improvements often appear quietly and gradually. Pain may lessen a little, sleep becomes more restful, balance feels steadier, temperature sensation may partially return in some areas. These changes can be easy to overlook if dramatic reversals are expected, but they are important. They show that new damage is slowing and that remaining nerves are performing better. Track progress over weeks and months, not just days. Nerve recovery is slow. Metabolic improvements take time to show. Normal fluctuations happen. A difficult day or week does not erase overall progress. Focusing on longer-term trends gives the most accurate and encouraging picture. In more advanced neuropathy, the main goal is to preserve whatever function remains. Stopping further loss can dramatically improve daily life. Less pain, better sleep, and improved stability support greater independence. These gains matter enormously even if full sensation does not return. Medical care continues to be essential. Sudden or rapidly worsening symptoms should always be evaluated to rule out other causes. Do not stop any prescribed symptom relief medications without consulting your doctor. Lifestyle changes complement professional treatment. They do not replace it. Current research increasingly views neuropathy in a new light. What was once seen as an inevitable part of aging is now recognized as something modifiable, shaped by lifestyle, metabolism, and overall health. Complete reversal is not realistic for everyone, but many people have far more influence over the course of their condition than previously thought. The most important change is one of perspective. Neuropathy does not simply happen. It develops within a specific internal environment. When you change that environment, you change the outcome, not quickly or perfectly, but meaningfully. Effective long-term management of peripheral neuropathy relies more on consistent small habits than on dramatic interventions. Nerves respond to repeated daily patterns, not occasional bursts of perfection. One strong week followed by a long lapse does little. But modest positive steps sustained over months and years can redirect the path of decline. It may feel slow in a world that wants fast results, but it matches how nerves actually adapt and survive. Aging brings natural changes that raise the likelihood of neuropathy. Insulin sensitivity decreases, cellular energy production becomes less efficient, and low-grade inflammation slowly increases. These shifts happen even in people who maintain good weight and appearance. They are gradual and easy to miss until symptoms finally appear. Recognizing them reframes neuropathy as the slow buildup of small imbalances over decades. Aging also weakens the connections between nerves and muscles. Motor nerves gradually pull back from muscle fibers, leaving some muscles under-innervated. Surviving nerves try to compensate, but there are limits. Over time, movement becomes less precise, balance weakens, and nerve muscle signaling fades. This raises the risk of falls and reduces activity, which in turn accelerates muscle loss and metabolic problems. Foot care becomes increasingly important as neuropathy advances. Reduced sensation greatly increases the danger of unnoticed injuries, ulcers, or infections. Daily foot inspections turn into an essential habit. Wearing proper footwear, moisturizing skin, and watching for calluses or nail changes help prevent serious complications. Many of the worst outcomes in neuropathy come not just from the nerve damage itself, but from preventable foot problems that go undetected. Chronic pain changes the way the brain processes signals. Sensory, emotional, and attention areas can become hypersensitive. This central sensitization amplifies pain perception and lowers tolerance. Managing neuropathy therefore includes calming the central nervous system. Simple techniques such as slow breathing, mindfulness, or gentle movement can reduce symptom intensity even when peripheral damage remains. Pay attention to important nutrients that support nerve health. B12 deficiency can mimic or worsen symptoms. Magnesium helps with nerve signaling and relaxation. Supplements should be guided by testing and medical advice, but identifying and correcting reversible deficiencies can make a real difference. Hydration affects blood thickness and flow. Mild chronic dehydration restricts microcirculation and reduces oxygen delivery to nerves. The sense of thirst often weakens with age, increasing risk. Consistent fluid intake supports better circulation. Social connections offer unexpected benefits. Loneliness raises stress, disrupts sleep, and reduces motivation for self-care. Maintaining relationships with family, friends, or community groups supports emotional health and indirectly improves physical outcomes. Activity often feels easier and more sustainable when shared with others, adding metabolic advantages. Fear of worsening can quietly limit choices. Some people avoid movement to prevent pain or falls, but this speeds up decline. Replace fear with informed, gentle action. Adapted exercise is safer than prolonged inactivity. Nerves benefit from appropriate use. Inactivity signals the body that the area is less important, lowering repair priority. Regular medical visits for chronic conditions can sometimes feel rushed. Coming prepared with clear notes about symptoms, recent changes, and specific questions leads to better discussions. Advocating for yourself improves care. It is not confrontation, it is essential for good ongoing management. Caregivers also need support. Watching a loved one deal with persistent discomfort is difficult. Understanding that progress is uneven and that ups and downs are normal helps set realistic expectations. Supporting caregivers ultimately helps the person with neuropathy. Over time, the effects of consistent constructive choices become clear. Those who focus on metabolic stability, movement, sleep, and emotional well-being often see slower progression and fewer complications. Symptoms may continue, but they become more manageable. Life stays active and meaningful rather than increasingly restricted. The most powerful idea is this: neuropathy is a condition you have, not who you are. You remain a person with history, relationships, abilities, and hopes. Keeping this perspective prevents the condition from taking over more of your life than necessary. B vitamin status deserves early attention. Regular monitoring of B12, folate, and B6, especially after age 50 or when taking medications like metformin or acid suppressors, can catch deficiencies before nerve health suffers. Early correction through diet, sublingual forms, or injections when needed helps preserve myelin and supports nerve resilience. Hydration, sleep, and stress management form the foundation of prevention. Enough daily water keeps blood thin and microcirculation strong. Consistent quality sleep protects the nightly repair phase, when inflammation drops and insulin sensitivity improves. Simple stress reduction practices, deep breathing, short walks, time in nature, prevent prolonged cortisol increases that drive higher glucose and insulin resistance. For families, prevention benefits everyone involved. Many of the same habits that protect nerves also reduce risks for heart disease, cognitive decline, type 2 diabetes, and other age-related conditions. When older family members demonstrate earlier meals, regular movement, gentler cooking, and nutrient awareness, younger generations adopt them naturally. Children and grandchildren learn that metabolic health is built day by day, not lost suddenly later in life. Conversations about neuropathy can shift from scary warnings, "Don't let this happen to you," to practical, encouraging advice, "Here's what I wish I had started sooner." Sharing simple changes, like family walks after dinner or milder cooking methods, makes prevention feel approachable rather than overwhelming. Screening matters too. Regular checks of fasting glucose, HbA1c, and, if possible, post-meal patterns can spot early metabolic shifts. Even within normal ranges, gradual increases over time can prompt small adjustments before permanent damage sets in. Asking about B12 and other nerve-supportive nutrients during routine checkups is another simple preventive step. One of the strongest preventive attitudes is curiosity instead of resignation. Rather than assuming nerves just fail with age, people who stay curious about how daily choices affect their body make more protective decisions. They notice how certain foods, late eating, or habits influence energy, sleep, or subtle sensations in the feet. That awareness guides small improvements long before symptoms force attention. Prevention is not about flawless execution or zero decline. It is about accumulating small protective factors year after year so the downward slope flattens significantly. Someone in their 70s or 80s with only mild occasional tingling, good balance, and reasonable sensation has usually followed these principles quietly for decades, not extremes, but steady, consistent habits. The information presented here is not secret or overly complicated. It draws from decades of research on metabolism, glycation, inflammation, nerve function, and aging. What is often missing is a clear, practical explanation of how these pieces connect, especially for people over 60 who are experiencing symptoms or supporting loved ones. Peripheral neuropathy does not have to be a mysterious or unstoppable sentence. It is a signal, a delayed message that the internal environment has drifted too far from balance for too long. The hopeful truth is that the same environment that allowed damage can usually be gently guided back toward conditions that slow further harm, stabilize function, and sometimes partially restore it. You do not need to reverse decades of change overnight. You simply need to stop adding to the problem starting now and keep doing that tomorrow and the days after. Each hour of more balanced blood sugar, each gentle walk, each better night of sleep, each step that reduces inflammation is a small vote cast in favor of nerve preservation. Over months and years, those votes add up. They do not erase every trace of past damage, but they rewrite the future, from predictable worsening to managed stability, from resignation to realistic hope, from feeling powerless to having genuine agency. That shift in understanding, from nothing can be done to I actually can influence a great deal, is where real, lasting change begins. And once it begins, in most cases, it keeps going.